Hi viewers, this is Karthik from CAAPID Simplified, and this video is for UCSF supplemental questions, specifically question number 4. How will you shortlist the school that you want to go to, and what would be the criteria to decide that? This is both an easy and hard one. Easy because we all have answers right at our fingertips. We might say, I want to go to a school with clinical experience. I want to go to a school which is close to where I stay. I might stay in the Bay Area and I want to go to a school in the Bay Area. I want to go to a school which has good weather, like sun and heat. I want to go to a school that will get me a quick job. I want to go to a school that has quite diversity, but also has a lot more people from my community. I want to go to a school that is associated with an academic research center. I want to go to a school that has a large student population, because more students by network effect will cater to more patients. I want to go to a school with a low student-teacher ratio so that I get more individualized attention. I want to go to a school that values candidates who are either young or who are old with a master's program, so that I can be with like-minded people. Either if I'm young, I would say I want to go to a school that there are a lot more people like me who have a lot of work experience ahead of them in the US, a lot of work years, and therefore the network I build within the school might help me even in the future runway. There would not be a disconnect between clinical practices we have. If I were old, I would say that again, I want to have like-minded people who have the same level of clinical experience and expertise that they bring from different countries, and which we can share actively to one another while in a campus here in the US. Now, I've told you a lot of this, but how do you start thinking about this? The way you structure your answer is pretty simple. First, talk about what is your short-term and long-term goal, and this is something you would have hopefully articulated in your statement of purpose or any other place. After you mention your short-term and long-term goal, now try to determine which criteria will help you see if you fit the school, or the school will help you get to that short-term or long-term goal. Now, obviously, it's easy to say that, beggars are not choosers, and any school might get me there. All I need is a DDS degree. While that could be the truth, you cannot obviously give out that answer. So what you must say is, these are my criteria. I want to establish a private practice. I want to work with diverse patients. I want to have a work-life balance. I want to be in a place which has low cost of living. I want to be in a work out of a DSO. I want to work in an academic institution. I want to be in research or academia. So try to mention what your long-term or short-term goal is right after DDS, and then say, okay, if I have to achieve this, if I want to get into academia and research eventually, or if I want to get into a residency program, what do I need in my DDS program? Do I need something that has complementary research going on? Do I need something that has people who are also applying to residency programs, so that I can study with them or something, have group discussions with them? Do I want to go to a program which creates commercial dentists? It's in a high end, it's like BU, it takes 80 people in, and they're all in the same mindset, living in the heart of the city, fighting for patients to treat on them, and you want to learn how it works in a competitive city like NYU or something, and then cater to a similar demographic of patients eventually. So the answer is pretty clear. First, short-term or long-term goal. Number 2 is define the criteria. List out the criteria that you would use for a school. And number 3 is justify fit. The fit is, how do these criteria help you determine a school that will eventually get you to your short-term or long-term goal? With these 3 points, you can nail this answer. All the best.